Okay. Yeah, I know. I thought about it. I imagine it would get some traction, but I'm lazy. I don't want to edit. So these vessels are called the coronary vessels. These blood vessels are called the coronary blood vessels. And they are responsible for supplying the heart with the blood it needs to function. It is what the heart needs to function. So we have a bunch of these, and they're responsible for feeding the heart what the heart needs. Now, I'm just going to pick one. It doesn't really matter which one, but let's take a second, look up here. We're going to imagine that we are looking inside of this little one right there. So that little one right there. Specifically, we're going to look at the end of it. And the end is responsible for feeding the part of the heart in that immediate area. So if I get that out of the way, this blood vessel is responsible for feeding like roughly that much of the heart. So it's responsible for there. That's where it supplies blood and therefore oxygen to. Now we are going to zoom in on this quite a bit. Let's imagine that this is our blood vessel. It's the same one. Don't worry too much about the direction or how big it is. We're very zoomed in right now. So, inside of our blood vessels is blood. And these coronary vessels are going to carry that blood to where it needs to go. For all of you in this room, for me as well, we have young, healthy hearts. And our hearts are capable of doing a lot of work. Over the course of your entire life, if you live to be the average age of like 78, your heart's going to beat 3.5 billion times. That's a ton of work. Part of the reason it's able to do this is because the heart has a great blood supply system. These vessels take good care of it. But as you get older, if you don't live a healthy life, these vessels can start to have things go wrong. And I actually don't like, I want this a little bit big. It'll work. That's fine. So as you get older, things can start to go wrong. So one of the things that people commonly don't manage is blood pressure. So just for an example, if you know anyone in your family who has high blood pressure, this is a concern for them. One of the big dangers of high blood pressure is that when blood starts to move too fast and with too much force, it will damage the walls of our vessels. I don't know if I've done this example for you guys, but this is personally how I picture it. Blood that is moving normally, normal blood pressure, is very slow and smooth, and just imagine it needs to, weave throughout the blood vessels, and it kind of follows where it's supposed to go, nice and smooth. But as blood pressure gets higher, it becomes a little bit more like a kid who's like really hyper. And if you ever watch little kids, they just like bump into things, knock things over, and they don't care, and they're just causing havoc. They're causing damage. High blood pressure does the same thing to our blood vessels. So over time, high blood pressure can cause areas of damage within the walls of the blood vessel. So here in green, I'm trying to demonstrate damage. This is a damaged wall of an artery. So, not a huge deal by itself. It's not a big deal. But this combines with other factors. Raise your hand if you have ever heard of cholesterol. What is that? Where do we get it? Does anyone know where cholesterol comes from? It's not a bad, they sound similar. No, it's not, but that's, I like where your head's at. We like looking for patterns. Most of our cholesterol is dietary, which means it's what we eat. What we eat is where we get a lot of our cholesterol. There is good cholesterol, there is bad cholesterol. If we go back a couple of years, it was maybe like 10 years at this point. A lot of people thought it was unhealthy to eat too many eggs. I don't know if any of you have been told that by a parent or like a teacher, like you have to watch how many eggs you eat. Completely false. You can eat 50 eggs a day. As many eggs as you want to eat, you can eat. Eggs are superfood. It's good cholesterol. But, just as a quick look, who's got food out? I don't, a couple, what is that? Like hot Cheetos or something? Sun chips? Processed? Animal crackers? Processed? It's okay at your guys' age. But as we eat more complex foods, more processed foods, and we look on the back for things like trans fat, you see trans fat on the back, trans fat is bad. Trans fat leads to cholesterol, unhealthy cholesterol. If there's a lot of words that you can't say in the ingredients, not great. Getting beyond the point. The point of this is not diet. But we start to get too much cholesterol. You've maybe heard it's usually a problem in men. Maybe your dad has high cholesterol. So why does that matter? Just imagine you have cholesterol floating throughout your blood. You know, it just kind of exists. Cholesterol has a function. It's not all bad, but if you have too much cholesterol, an unfortunate effect of cholesterol is that it's very attracted to areas of damage. Without getting into the microscience of it, cholesterol sees this damage and it says, that seems like a cool place to hang out. And so you start to get cholesterol depositing itself in these areas of damage. And over time, and when I say time, I'm talking about decades. Usually over 20, 30, 40 years, this cholesterol accumulates. And it gets bigger and bigger and bigger. And you end up with this little mound, which we call a plaque. This is called a plaque. If we were to look at this image, roughly how much of the blood vessel do you feel like this plaque is taking up? Like in terms of how wide it is. Roughly how much of this plaque is taking up space? Like how much space would you say it's taking up? Roughly. Anyone?
Half?
Yeah, roughly half. That's the word I'm looking for. Yeah, roughly half. So what does that mean? Half as much blood is able to flow past this point. Half as much blood is able to flow past this point. Now, you might be wondering to yourself, cool, why does this matter? So for you guys, and me, hopefully, our blood vessels are nice and clear. Nothing's in the way. If I were to tell all of you to stand up, we're going to do 50 jumping jacks. We're not actually going to do that. But if I told you all to stand up and do 50 jumping jacks, what you are doing is moving muscles and you are increasing the need for oxygen and you are increasing the demand of your heart to pump blood. So if I told you to exercise, what would likely happen to your heart rate? It increases, it goes up. That makes sense, right? As you do more work, your body needs more oxygen. How does our body deliver oxygen? The heart pumps blood. So the heart needs to pump more. But the heart is also a muscle. And so if the heart works harder, it also needs more oxygen. As your heart rate goes up, the demand for oxygen on your heart itself also goes up. And so normally, for us, that's not a big deal. These vessels just give more blood. They pump more. They'll get wider if they need to. They'll increase the speed if they need to. And it's not a problem. Some of you might be upset at me, but if I made you all run a mile right now, you're all capable of that. Would you enjoy it? Probably not. But can you do it? Yes, you have good cardiovascular health. You're all capable. But if you live unhealthy for 20, 30 years, you can start to have these plaques develop in different spots in your body. It is dangerous when they develop in these. Why? Because these are little blood vessels, little tiny blood vessels. And a plaque like that, which is microscopic, super small, it's like the size of a pebble, can block one of those small vessels. So, in this situation, we can end up where the amount of oxygen that is able to make it through is not able to meet the demand for oxygen. If we take someone who has one of these and we say do 50 jumping jacks, it's possible that their heart, now working harder, is not able to get enough blood to kind of repay the oxygen it's using. So we end up in what's called a deficit. Do we understand the word deficit? If I say that, do we know what I mean? We're using more oxygen than we're getting in return. So we're like negative oxygen. What happens when someone's heart is in a negative oxygen, when there's a deficit? We've already learned it. There's a term for it. What happens when the heart is low in oxygen? Hypoxia is the condition. What happens to someone who has hypoxia in their heart? What will they feel? And what is the name of that chest pain? Excellent. So that is a key connection. That is a key connection to understanding this lesson. When the heart ends up in an oxygen deficit, pain is the result. The name of that pain is angina pectoris. Usually we just call it angina. So, key concept number one in the bag. How are we feeling so far? And I actually need your feedback. Thumb up is good. Thumb sideways is eh. Thumb down is I don't know. Okay. So mostly up is good. If we're sideways, that's okay. This is a complex topic. But you guys are doing good. So, in the event that the oxygen does not meet the demand, pain is the result. And the name of that pain is angina. Now, there are two common ways that angina can present. We are going to talk about stable, and then we are going to talk about unstable. Stable and unstable. We will start with stable. Stable usually happens in a patient that looks something like this. We see a situation like this. So take a look at that image. We've got a plaque in there. That plaque's covering a pretty good amount of the vessel. And as people just hang out and live their life, as they go to work, as they sit in their car, as they watch TV, nothing is wrong. They're living their life and it's fine. But when these people exert themselves. Does anyone know what I mean by exert? What is exertion? If I use that word, do we know what that means? What's exertion? Can you give me like a synonym? Work, effort are two good words. Exertion is like exercise, it's effort, it's work that we're doing. It doesn't have to be going for a run. For certain people, exertion is going upstairs. For certain people, exertion is standing and going to the bathroom. It depends on who you are, it depends how old you are, it depends on your general health. But exertion is the idea that your demand, the work the body is doing has increased, and so the demand for oxygen has also increased. If these people exert themselves past a certain point, the amount of blood that can make it through this choke point might not be enough. So at rest, these people are typically fine. But with stable angina, you will likely get pain caused by exertion. You will typically get pain caused by exertion. And I see a lot of you are writing the words. I want you to understand what the words mean. The pain is caused by exertion because as you work harder, the demand for oxygen goes up. And this plaque is preventing enough blood to get through to supply the necessary amount of oxygen. And so they start to experience angina as a result of exertion. So let's imagine a person. A person, and this is something that, this is a very kind of textbook example of what I'm talking about. But let's picture a man who's about 52 years old. He weighs 285 pounds. He's a bigger dude. Something happens with men in their mid-50s where they have kind of a crisis. We call it the midlife crisis. And let's just imagine that this man has been kind of overweight for a long time. And he says, I'm tired of being fat. I'm going to go try and exercise. I want to lose weight. I want to live longer. I don't want to die at 60. I'm going to get out there. I'm going to kick ass. I'm going to go for a run. This happens. We get people who have been in bad shape for their 20s, 30s, 40s, and then suddenly in their 50s, they're like, oh shit, this is not good. I'm going to turn it around. And so what does this dude do? He decides, I'm going to go for a run. I haven't run in 30 years, but I'm going to go for a run today. And sometimes these people have these conditions. They have this plaque inside of the vessel. And so they go for the run. And about 5 minutes into the run, it's like, damn, this is hard. And then 5 more minutes, it's like, wow, this is really hard. I don't know if I can keep going. And then 15 minutes, they're like, I think I'm having a heart attack. And so they call 911. This happens. Call 911. They think they're having a heart attack because they're having intense chest pain. Usually, when people have this experience, they would then stop, sit on the ground, find a bench, sit on the bench. They'll stop. And as they stop, the demand starts to decrease. They're no longer doing that exertive exercise or that activity. And so as they start to rest, the demand goes down. And as the demand goes down, so does the deficit. We're no longer negative oxygen. And so when we reach an area where the amount of oxygen is okay, the pain goes away. So pain is relieved. What do I mean by relieved? Someone give me another version of that word. If something is relieved, what does that mean? Let go, lessen, reduce, disappear, eliminate, cured. Basically, the pain is going away. The pain is relieved by rest. The pain is relieved by rest. There is a version of this lecture. I'll give you a second to write it down. I don't want to interrupt you. So if you're writing it down, take a second. There is a version of this lecture in which it takes 10 minutes. And I just say, there are 2 types of angina. There's stable and there's unstable. And stable, this, and this. In that version, you don't learn a lot. You memorize some facts, but you don't understand. So I'm taking this long-winded approach because understanding what's happening is going to allow you to use this information a lot more effectively. So, a question that we ask our patients suddenly becomes very, very important. Someone give me the E in sample. What is the E in sample? Events leading up to. How would I ask that question in plain English? If my patient was in front of me, what might I ask them?
What did you do before this?
Yeah, what were you doing? Like, what was going on right before this? And our patient says, you know, I recently decided I want to lose weight, and so I went for the first run in 30 years. Wow, okay. Suddenly, a guy with chest pain lets me know that his chest pain started with exertion. And so that makes me think initially, okay, this might be stable. And if he hasn't already sat himself down, we will sit him down and tell him to get some rest. It says 3:30, no?
Yeah.
It's 3:05. Sit down. Isn't it 3:05?
It's 327.
Why does it say 3:05? Oh, it's because it's a screenshot. Okay, go ahead. Sorry about that. 3:27. Okay, we can make that happen. We have the person sit down, if they haven't already sat down, and we will ask them, what's the P in OPQRST? You might need to flip back a couple pages, I don't know. Anyone got the P in OPQRST? Provocation. The way we typically ask the question is, does anything make it feel better or worse? Has your pain changed? And if this is stable angina, we expect that as they rest, the pain goes away. So in this patient, he called 911 because he started having chest pain because he was working too hard. He takes a seat, the demand decreases, and the pain goes away. This is good news. It is unlikely that this person has a heart attack, so long as we tell them not to overexert themselves. They need to go to the doctor, they need to be put on medication, they may need some sort of surgical intervention, but this should not become a heart attack unless they overdo it. What will happen is they'll work hard, they'll have pain, they'll sit, the pain will go away, and they enter like that kind of loop. They'll go to a doctor, doctor will give a medication, and it may even start to cure the condition. But as you guys have learned, a lot of people don't go to the doctor. And so what happens sometimes is people just keep living unhealthy lives, and this plaque can get bigger. It can grow. In bad situations, this plaque can actually develop a pump. It can burst. I imagine it being like a pimple. It's not, but that's how I imagine it. And what can happen with high blood pressure is this plaque can rupture. And if it ruptures, it will leak material. Kind of like when you pop a pimple and pus comes out. It'll leak material. Now, does anyone remember what in our blood is responsible for clotting? I've taught you guys this. It's been a while. But we have little tiny cells in our blood that's whole job is to go find areas where we're bleeding, little holes in our body, and plug them. Anyone know that term? It's okay. I think I heard someone whisper it. But that is called a platelet. It doesn't really matter, but I just like to connect dots when I can. So platelets. Platelets are all over your blood. And I wish I had another color marker because red's getting redundant. But you have platelets in your blood. And platelets' whole job is to go and plug holes. And for some reason, the platelets are super attracted to this material. What's inside of the plaque mimics bleeding, and so the platelets are like, uh-oh, there's a hole we need to plug. And so one platelet discovers it, and it sends a message to all its other platelet friends saying, hey guys, we need to go to work, come here, and let's start to form a clot. And as they collect, you get this clot. And as this happens, this clot gets bigger and bigger and bigger until eventually it is now doing what? How much of this vessel appears to be blocked? 100%. I mean, if not 100, like 98, 99. Like a lot of the vessel is covered. And so in this situation, because there's so little blood able to get through, it is likely that a patient will begin to become deficient and therefore experience pain at rest. A key difference. Pain at rest. So that answer matters. What were you doing? In a chest pain patient, it very much matters. If they say I was asleep and I woke up with intense chest pain, is that exertion? No. That is chest pain at rest. And this is not good. Why is this not good? Well, yeah, pain sucks and we don't want people to be in pain. But the real reason that this is a big deal, and we're almost done, I promise. The real reason this is a big deal is because this will not, let's rewrite that. Let's say, this pain does not self-resolve. Does not self-resolve. What do I mean by self-resolve? It does not go away on its own. It does not go away on its own. It does not self-resolve. I know a lot of you are already having the impulse to pack up. Please don't. I'm almost done. This pain does not self-resolve. Why? Look at the picture. This clot is there. And it is not going anywhere. We can't reach inside people's vessels and pull that out. If you decrease the demand on the heart, you can't. Like, how would you go lower than at rest? There's no point in your day at which you require less oxygen than when you're sleeping. That's like as rested as you can be. And if you're in a deficit while sleeping, we can't decrease the demand. That's not a possible solution. This will not go away. And so what happens in a situation like this, if untreated, will become a myocardial infarction. After a certain period of time, the deficit leads to cellular death of heart muscle, and you have experienced a heart attack. Question?
If you're like unstable and like blood is starting to clot, would taking aspirin help it?
That's a great question. And